Hi, I'm Desi Carlos. I'm a dietitian from Tree of Life Nutrition. IBS, or irritable bowel syndrome, is really symptoms relating to the discomfort that is experienced, I should say, in the gut. And so the symptoms would be distension or bloating. They could be a stabbing pain. They could actually be excessive wind production, burping, or flatulence, and changes in bowel motion. So whether it's loose or hard, or a combination of both. So some people oscillate between the two. And basically you can get some refluxing as well. So all of these symptoms are IBS. Some people also term IBS as leaky gut or intestinal permeability. So they're a little bit different, but ultimately the symptoms are the same. So the way that we treat IBS treatment in nutrition is that we look at two certain aspects. Let's just also say that this is the Tree of Life Nutrition way. So the first aspect is that we look at the gut microbiome. So we know that the bacteria in our gut is comprised of good and bad, and then we have yeast in there as well. Now we all have all of those things, and we pick them up from birth, and then we pick them up when we're breastfed, and then when we start eating, and then when we're playing, and all these exciting things where we pick up a lot of bugs which actually start to infiltrate our system or our gut microbiome. Now, over time, things can affect that balance and cause dysbiosis. So that dysbiosis is basically caused by the use of antibiotics, anti-inflammatory agents. It can be caused by any medication, really, to be honest. And so, and also changes in eating practices, excessive alcohol, trauma, all of those things, change in lifestyle, all those things can influence the gut microbiome. So let's face it, we are all going to have some effect on our gut bacteria at some point in time in our lives, and hence why we are seeing so many people with gut-related issues. And so here is what we want to do. We want to fix the gut microbiome, because what is so bad with living with IBS? Well, for number one, it's completely uncomfortable, and in some cases it can be very, very painful. And if you have other inflammatory conditions like endometriosis, adenomyosis, any inflammatory condition, IBD, inflammatory bowel diseases, celiac, all those sort of things will be influenced by our IBS type symptoms. And so if we can actually control those symptoms, then what's going to happen is that the inflammatory condition is also going to be controlled. So we know that bacteria in our gut plays a crucial role in making us feel very well or very bad. So the first point of call is to actually treat the gut microbiome, the bacteria in our gut. So what we want to do is we want to increase the good bacteria, reduce down the bad bacteria, and reduce down the yeast production in the gut. Generally, from a nutritional point of view, we can start to feel foggy, or we can get quite anxious. These are other symptoms that are associated with IBS. Sometimes we can come out in rashes. We can feel very inflamed, like in our arms and our hands, and even our face can be quite puffy. So all these things, of course, are going to be or are symptoms of IBS. So if we look at the gut microbiome, we want to increase the good bacteria, and we do that by increasing the fiber intake. So we want to get over 30 grams of fiber, soluble, insoluble, resistant starch, phos, GOS, lots of different fibers to actually enhance the production of the good bacteria and fuel them and give them the prebiotics that they need. They're probiotics. So that's the first port of call. The second port of call is to reduce the bad bacteria, or stop them from growing in large quantities. And so reducing down saturated fat and sugars is the best way to go from that perspective. So saturated fats being animal fats, including dairy and also coconut products and chicken, meat, all those sort of things, but the fat component of that, not the lean component. So by reducing all those things down, we're actually improving the performance and also the ability to grow the good bacteria in the gut. So our key focus here is to increase the good bacteria by increasing fiber, decrease the bad bacteria by decreasing sugars and saturated fats, and also supplying lots of different types of fibers in lots of different forms. So by doing this, we're actually now reducing down the risk of the dysbiosis that we're experiencing. We have a very, very important way in which we fix the gut microbiome, which is our little secret. And you can come and see us if you are not experiencing any benefit and you need a little bit more individualized care regarding the gut microbiome. But think of the gut microbiome as a real thing, a factory where lots of swatters have come in and we're trying to kick them out. And we're trying to create this new factory, a super duper factory where keen new workers want to come home or come to the factory. So that's what we're trying to do. Now let's just say that that alone doesn't fix the IBS. So then we start to look at food-related intolerances. So you may have heard that, most people think gluten's affecting them. Most people think dairy's affecting them. Perhaps even soy might be affecting you, or FODMAPs or food chemicals. But rest assured, our Tree of Life dietitians are definitely going to solve the problem because we are specialist dietitians in the area of IBS. How about you come and give us a go? Please don't go straight onto a FODMAP diet without seeing a dietitian. And remember not to stay on any diet longer than 4 weeks, because by doing that, you're actually adversely affecting the gut microbiome. So it's not beneficial to stay on any sort of diet long term unless you've seen a dietitian and she's actually been able to work out what exactly is causing the problem. And don't think that it's always food related. Sometimes by fixing the gut microbiome, we can actually start to eat a variety of different things. And don't forget, the Mediterranean diet, another specialty area of ours, is the main way to fuel the gut microbiome and therefore decrease the risk of IBS. So we look forward to seeing you at a consultation soon.